Now you'll assess the neck, beginning with inspection.
I'd like you to lower your gown. I'd like to look at your neck.
Okay.
The patient's neck should hold his head erect and midline. It should have symmetrical muscles and no swelling or masses. If you see swelling below the jaw angle, palpate this area to check for a parotid gland problem. Now assess the neck's active range of motion by having the patient touch his chin to his chest, turn his head to the right and left, tip his head toward his right shoulder and toward his left shoulder, and tilt his head backward. All of these movements should be smooth and
I'd like
painless.
you to sit up straight, put your shoulders back.
Next, assess the spinal accessory nerve.
And I'm going to
Apply resistance to the patient's shoulders as he shrugs them.
shrug your shoulders.
The shoulder muscles should be symmetrical and able to overcome your resistance. Now have the patient turn his head to one side as you apply resistance to the side of his chin. Then have him turn his head to the other side as you apply resistance to the opposite side of the chin. Note the contraction of the opposite sternomastoid muscle and the force of the movement against your hand. Movements should be equally strong. Next, move on to the lymph nodes in the neck. With the finger pads of both hands, bilaterally palpate the nodes using a circular motion. Palpate the lymph nodes in this sequence: preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Note the size, shape, consistency, mobility, and tenderness of the nodes. Be sure to compare one side to the other. Normally, the lymph nodes are small, soft, non-tender, and movable. If you detect swelling or tenderness, search for a possible cause. Now inspect the jugular veins using tangential lighting. With the patient supine and his head elevated 30 degrees and turned away from you, internal jugular vein distension may be visible. Observe the jugular vein pulsations. They should undulate softly and may decrease with inspiration. Note unusually prominent pulsations. Now, with the patient sitting up, identify the trachea by locating the sternal notch and sliding your fingers to each side of it. The trachea should be midline and symmetrical. Stand in front of the patient. Use the fingers of your left hand to push the thyroid gland to the right. Curve the fingers of your right hand between the trachea and the sternocleidomastoid muscle. Then ask the patient to extend his neck and swallow.
Extend your neck.
You should feel the thyroid move up and down as he swallows. Then palpate the thyroid gland from behind. Place the fingers of both hands on the patient's neck with your index fingers just below the cricoid. Palpate both lobes and the isthmus. Instruct the patient to sip and swallow during the exam. Note the size, shape, and consistency of the thyroid. If the thyroid is enlarged, auscultate it for bruits with the bell of your stethoscope. A bruit is a blowing sound caused by turbulent blood flow.
Good, that was fine.
Next, observe the carotid arteries for visible pulsations. Gently palpate the carotid arteries using your index and middle fingers. Remember to palpate one carotid artery at a time. Otherwise, you could block blood flow to the brain. Don't press too hard over the carotid sinus area located higher in the neck, because this could cause vagal stimulation, which could slow the patient's heart rate.
Yeah, I'm going to listen to
Next, have the patient take a deep breath and hold it as you listen to the carotid artery with the bell of your stethoscope. You should not hear a bruit.